Hello there! So in this video, we will be discussing about leptospirosis. You must have wondered, what is leptospirosis? You've never heard of it before, right? Well, actually, you have. Leptospirosis is commonly known as kucing tikus in Malaysia. Leptospirosis is a relatively rare bacterial infection that affects people and animals. It can pass from animals to human when an unhealed break in the skin comes in contact with water or soil where animal urine is present. The disease also can be transmitted through direct contact with urine, blood, or tissue from an infected animal. The bacteria can enter the body through open wounds or through the soft tissues on the inside of the mouth, nose, or eyes. So, one can get the disease by swimming or wading in fresh unchlorinated water contaminated with animal urine. Animals that transmit the infection to humans include rats, skunks, opossums, foxes, and raccoons. But do not be worried because chlorinated water, such as that in swimming pools or municipal drinking water, has not been shown to transmit leptospirosis. And generally, it is not transmitted from person to person.
Hi everyone, I'm Fatin and I'm going to talk about the symptom of mild leptospirosis. Firstly, if you are having a mild leptospirosis, you will get high fever, coughing, muscle pain, red and irritated eyes, and also jaundice. Most people recover within a week without treatment, but around 10% go on to develop severe leptospirosis. Symptoms of severe leptospirosis depend on which vital organs are involved. If leptospirosis affects the heart, liver, or kidneys, the person will experience fatigue, nosebleed, unexplained weight loss, swelling of the hand, and so on. But if it affects brain or spinal cord, the symptoms may include inability to speak and sensitivity to light, or we call it photophobic.
Leptospira is a genus bacteria known to cause leptospirosis. This bacteria possesses a number of virulence factors that help it attack and destroy the whole cells. Serious problems start when this bacteria gets into the bloodstream, where it can move to infect other organs. This typically happens in two stages. In the first stage, the bacteria are confined to bloodstream and there are no signs of an organ damage. In the second stage, the infection becomes more severe as the bacteria spread to almost all internal organs. Frequently affected organs include the liver, where the bacterial toxin damaged liver sinusoids and hepatocytes, causing jaundice. When the lungs are affected, the toxin damages the alveolar capillary membranes, which can result in bleeding within the alveoli. Finally, sometimes the bacteria can even migrate from the bloodstream and use its toxins to break through the endothelial cells, causing meningitis.
So people, how well do you know about leptospirosis? Before this, leptospirosis has become one of the spotlight in our country due to thousands of cases reported starting from 2011, and there were hundreds number of deaths. Although the number of reported cases has dropped year by year, but we must continue and improve our general cleanliness. Prevention is better than a cure. So how do we prevent it? We need to make sure that our surrounding is clean. First, we must wash bottles or can before opening it, as it might have risk to be contaminated by the rodents' feces. We also must not litter, especially food, as a dirty surrounding may interest the rat because the smell of the food itself will attract the rats. Furthermore, when there are flood season, especially in Kelantan and Terengganu, we must prevent the children from playing by the water, as the water have higher risk to be contaminated by the feces of the rodent.
So next, how to treat patients get infected with leptospirosis? Usually, for mild cases, the doctor may prescribe antibiotics such as doxycycline or penicillin. The doctor may also recommend ibuprofen for fever and muscle pain. Patients with severe leptospirosis will need to spend time in the hospital. They will receive antibiotics intravenously. Depending on which organs leptospirosis affects, the individual may need a ventilator to help them breathe. If it affects kidneys, the function of kidney may be failed, so dialysis may be necessary to filter the blood by removing waste and excess fluid from the body. Moreover, during pregnancy, leptospirosis can affect the fetus. Anyone who has the infection during pregnancy will need to spend time in the hospital for monitoring.